Welcome to Advisors on Growth. I'm your host, Derek Colin. In today's episode, we have Ryan Seaberg. He is the CEO of EirSystems, Inc. How you doing today, Ryan?
I'm good. Really appreciate you taking the time today. Love getting to speak to everybody.
Awesome, man. Well, can you kind of give us a deep dive into your background as well as how your role as the CEO fits into the bigger picture at EirSystems?
Yeah, so it's a pleasure to meet everybody. As Derek said, my name's Ryan Seaberg. I'm the founder of EirSystems Inc. We started this company around 8 years ago, but previous to that, I was actually playing professional football. So that was my whole dream, my whole life was to, go to the NFL, live the athlete dream. And I got to get a taste of that, which was great. And then kept having injuries over and over, where eventually I had a career-ending injury. Came home, got prescribed all these different opioids, had all these surgeries. And I remember sitting on my couch one day and there was like 8 pill bottles on my counter. I wasn't taking any of them, but I had a friend who had passed away previously from an opioid overdose. And so I think when bad things happen, there's 2 things you can do. You either, wallow in it, let it define you, or you use it as motivation to make a change. So I sat down with my father, who was an ER doc, basically said, what do you hate? What do you like? What do you need? And that was the initial kernel for how EirSystems got started. And my role day to day is just directing the strategy, creating the partnerships, making sure customers are happy. But really, I have a great team behind me. Our developers, Lumi, Dennis, my brother Tyler leads the implementation. So got a great team that I trust to do all the work I need to do. And then it's just about me directing the strategy and making sure we're in a good spot to do that with finances.
Yeah, that's good. I mean, it sounds like it kind of hit home for you while starting this company, or it touched at the heart of something personal. And it's good that you also have a team of people that built your company with that you can trust.
Yeah,
That's important. Yeah.
100%. Because I think that's one thing, what I loved most about sports was like what you put in is exactly what you get out of it. And so I think running a business is very similar, where I'm only going to be successful if I do the work. There's nobody else you can rely on, especially when it's your company. And I think, getting to actually sit in there day to day with our EMAR, which is an electronic medication administration record, getting to work with these drug treatment centers, these senior living facilities, psychiatric facilities, getting to see the people we affect every day. It's the best gift in the world. That's what keeps me motivated. And having a good team behind you that makes it easy is truly the dream. And we took a lot of twists and turns to get here, but we've got a great team that's gotten us a lot of growth over the past year, which has been awesome.
Yeah. So when it comes to, and correct me if I'm wrong or if I'm digressing here, physical therapy or sports medicine, or doctors that are in sports, because you come from a football background. I'm sure you've seen the movie Concussion with Will Smith.
Makes me cry every time.
And we were just talking about Will Smith and AI, for those of you who don't know. But how does this system and what you guys are building kind of assist with that as well? Because I know concussion is a real thing.
Yeah, so really the core of our system, what we do is we track, hey, what room are you in? What medications are you on? What time are you taking them? Any inventory, and all of the different state and federal reporting requirements to keep you safe and compliant. So a lot of our work is in inpatient, but we also do work with a lot of outpatient centers. And that's where if you have somebody who maybe has had a couple concussions, has some sort of mental health condition, and they need outpatient treatment, we help them track, hey, we have these many drugs in our inventory. Ryan's coming in to get it today to get these medications. They can set up alerts to follow up with them so people don't slip through the cracks. That's really the core of the business, is I just don't want people to slip through the cracks. I want the people who need help to get help.
Yeah. And based on the loss of your friend, I'm sorry to hear that, by the way. So yeah, that's real important to track the medication and to make sure that they're getting the proper treatment so that they're not overdosing or overusing and over medicating.
Yeah, 100%. I think that's a big thing. And it's another kind of flip of that too, is I think our system, we've seen it with some of the, methadone treatment centers we've had, where we had one, it was an Indian Health Network, and they were seeing about 400 people a day before our system. But after they put it in there, they were able to see 620 total. So 220 more people a day from using our system because it was that efficient. So we're allowing more people to get the help they need, which I think is really what we can do best. Is sure, tracking it's great, making sure people aren't overdosing is great, but making sure more people can get help and the doctors can stay sane, they can make sure they're safe and compliant. That's really a recipe for success right there.
Yeah, definitely. That's awesome. Increasing productivity and getting to more patients, more efficient rate is always a quality thing. So what major shifts are you currently seeing in your industry right now?
Yeah, I mean, I think the one everyone's talking about obviously is AI. AI is starting to creep into some of the decision-making processes. We're having to see what can we automate, what can we do better with AI that we probably couldn't before. And I think one thing we're seeing too is, we're an aging population, especially all the baby boomers. They are going to be entering these senior living facilities coming up in the next 5 to 10 years, a lot of people. And so that's a massive growth sector where I think it's supposed to grow 11.3% year on year to 2030, and it's only going to grow from there. So you're seeing a lot more focus on the senior living space, and there's a lot of technology out there that isn't really helpful for a lot of the actual clinicians and staff using senior living. So that's one thing we've been putting a lot of our effort into, is how do we make this process easier and simpler so that way we can meet the demands of the market that's coming, because people are going to be moving into these facilities whether they have the tech or not. So we need to meet them where they're at.
Yeah, yeah, definitely. Awesome. So it sounds like you like AI, or you guys are implementing AI into EIR.
Yeah, so I was one of those, I'm kind of a Luddite a little bit, where I have an iPhone 4 still. It has one of the home buttons. I got no
No way.
social media. Yeah, I'm old school. So I initially was like, I'm never using AI ever. And then I bought it for my developers. We're using Claude. And I remember I had to put together a financial report. I remember, and Claude did it for me in like 10 minutes. And I was like, I'm a believer now. So we're trying to do a lot more of, that was the start, but we're trying to do a lot more of, how can we start projecting, hey, is somebody at overdose risk right now in your facility? What's the suicide risk? So trying to kind of use AI for risk scores, trying to use AI to help make sure, why are staff members missing meds at this time? So that way your managers and the admins can actually see the different trends going on in their different facilities right now. So that's kind
Yeah.
of some of the initial parts, but there's infinite ways that you can kind of expand into. I'm sure, as you've seen with these other companies, there's a lot of opportunity out there. It's just trying to find the right opportunity that helps our clients.
Yeah, no, that makes sense. You can implement AI with propensity scores and certain testing assessments for like behavioral health or not behavioral, but behavioral attributes, like where their mindset is at, to sort of give out a blueprint to a doctor or physician, someone who's certified, who can say, okay, this may lead to something. We need to tone it down on his medication. We need to look at, providing him with the care that he needs to be preventative.
Yeah, no, I mean, 100%. I think we've seen that a lot with, one thing we see with like drug treatment centers is they have these things called PDMPs, which is a prescription drug monitoring program. Every state tracks every controlled substance that's given to people. But there's so much data just sitting there that nobody's really using. Like if I pulled up, my grandpa's, PDMP, he'd have like 70 medications on there. With AI though, you're able to actually kind of go through that and say, oh, is there been an increase in controlled substances lately, or are they abusing? And you can actually start to have some preventative care, which really wasn't truly available before. So it's an exciting time to be in this industry, I think.
Yeah, yeah. So I guess the next question would be, what's working well for you guys, and what's been frustrating?
Yeah, so I think we were really, really grateful when we originally started with an e-prescribing product, electronic prescribing, and we built and sold that about 2 years ago now, 2.5 years ago. So with our current EMAR product, we really had a very large customer, was our big EHR, AdvancedMD was our first customer, and they took a chance on us. We had 0 customers, 0 revenue with this new product. And that was kind of where the idea was born, where we really thrive on these kind of channel partnerships. So with an EHR like that, they have 100 salespeople. And so if we can provide and become an enablement platform for them, so they can't close deals without us, we become critical to them. It opens up new markets. That way they're going out and selling it. We keep our burn low and they just bring us hot leads. And so I try to follow the strategy of irons in the fire, have as many EHR partnerships as you can, because you're going to get more opportunities that way. And with partnerships and things, some of them don't work out the way you want to, other ones surprise you. So it's been great having that. One thing I think that we've really been struggling with is it's interesting trying to train all these different sectors of healthcare. We have everything from senior living, behavioral health, medication assisted therapy, depression therapy. And so you'll see like there tends to be people hate change. And so trying to find different ways to train people to make it easier that they can do it in their own time, on their own schedule. We've been trying to play with different things. We've been using AI to create some training guides and things like that. But really the implementation is probably the most frustrating part. And I'm sure anybody who works in healthcare on either side of it will tell you it's never fun.
Yeah. Yeah. No, I wholeheartedly agree with you.
So we've had some interesting,
healthcare can be a nightmare.
yeah, we've had some interesting experiences for sure over the years.
Like, okay, so is there certain metrics that you guys are focused on, or are you allowed to talk about, what stage you're at in terms of funding, your growth, revenue, where you're looking at in terms of scale, expanding, all that good stuff?
Yeah, so it's been a great year so far. So we've grown 584% this year so far. So been an amazing year. We've gotten up to close to 100 different clients, and clients could be everybody from a mom and pop to somebody who has 35 locations. What's been exciting is we did just get white labeled by AdvancedMD and a couple other EHRs. And so we've become technically an in-house product for them. And where we're at today, we are doing a current seed round. With the previous product we sold, we were a little further along, but this is a seed round for the EMAR. We've got a couple interested parties, and if anybody wants to hear more about what we're doing, please reach out. But with the money we're raising, we're really doing that to meet the demand we have, because we have a lot of business coming in. It's stressful, but a good stress. And I think really just trying to grow our team so we can continue to provide the great service, the great customization, and, raising this seed round will help us get there. So that's kind of where we're at today.
Awesome. So yeah, so you said you got funding, you guys are generating income year over year. How long have you guys been operational for?
So the company itself was 8 years operational, but the EMAR is technically a new product, a new asset, and that's been 2 years. So it was January 2025 was our first year. So our first month.
Cool.
So yeah, we had our first profitable month this past month. So very excited about finally reaching that. So definitely got to go celebrate that eventually.
Oh yeah. You got to fly me down. No, I'm just kidding.
You get a vacation, man. I'll come to you in San Diego, man.
Yeah, come to San Diego. Cool. So yeah, so you guys are expanding. It sounds like you're doing well. Are you hiring a team of sales experts, or what's the next step for growth?
Yeah, I think really we kind of see it a 3-step process. So first and foremost, the most immediate need is that implementation specialist. So hiring people who have experience, maybe rolling out to large enterprise customers who can help us make our processes better. And then building out the support team along with that is key. We also need to hire another developer and kind of expand our development team just with the work we have coming in. And then medium to long term, we want to hire, someone who's either a chief revenue officer, a COO, a chief operating officer, somebody who has experience in healthcare, because I started this company when I was 24. And so I've been drinking from a fire hose for 8 years. So definitely want to make sure that any of the money we bring in, any of the partners we bring in, that they can help us reach these goals by avoiding a lot of the pitfalls I think entrepreneurs make a lot of times.
Yeah. And those sales reps are guys that you want front facing for the product. Do they have to have like tech software background or?
No, so I think that's one thing that I've kind of realized is it's what I love about it. I'm gonna make another sports reference, but it's like a team, I think, and I think for me, we've had some people who are very skilled at what they did, but they didn't quite mesh with us personality wise, work ethic wise. And so for me, I'd rather have somebody who has the personality, who has the work ethic. You can teach anybody anything. Sales is sales. I think it's like 99% natural. If you have the personality, the gravitas, it's beautiful. And so that's really what I'm looking for, is just bringing on people who we can work with, who we mesh well with, because when everybody's working in the same direction, that's when you're moving, that's when you're growing, and that's what gets me excited.
Awesome. Yeah, that's cool. So yeah, I mean, what's working well for you guys right now, and where are you looking to expand into different territories, or is there specific locations, or is it just industry?
Yeah, so we did just have our first client in Alaska come on, so that was pretty cool. So we are in 41 states right now, which is great. I think for us, it's more industry, like it's healthcare vertical wise. And so this year it was really senior living and behavioral health are our big bread and butters. But we've really started growing into the IDD space, so intellectually disabled, eventually moving to the hospital space, ambulatory EHR or emergency rooms, things like that. So finding these different sectors that we've got some unique functionality not seen in the healthcare space before on an EMAR. So I think if we can just make sure that it fits their needs and we can customize that it's going to open up a whole new sector of the market for us, which is great.
Yeah. So 41. What about Canada, Europe, or other territories? Not quite there yet, but is that an option on the table?
Yeah, so I think that's something that we have been discussing. I've one of our advisors, Rick Seaberg, my uncle's actually been helping us. But one thing we've been trying to discuss is what the next step would be. And I know the UK and Canada, it's nationalized healthcare, so it's typically a little more difficult to get into. But we have been looking into the Middle East and some of the European countries that are a little more amenable and have a massive need over there. Because I lived in Europe for a while. I've seen the healthcare space over there. It's incredible what they do with nationalized healthcare, but I feel like the technology and some of the services lack a little bit. And so if we could go in there and help them expand that and provide a cost conscious solution, that's the big plan, to take over the world eventually.
Yeah. I like what you said, a cost conscious solution. So let's talk about your unique value proposition. What do you want people out there to know who should, sign up and at least test out or use EirSystems, small facility or big?
Yeah, so I think one thing we bring to the table is we've seen this over and over in healthcare where somebody gets bought out by a larger company, they stop listening to customers, they stop providing good service. And so one of the good things about working with us is that you get to work with the people who built this from the ground up. We answer your calls. You'll have my phone number. We'll customize it. It makes it so it's a very intuitive system built to your needs. And that comes along with some unique functionality. Us having an entire hospital to test this out with, physicians to test this every step of the way. We try to make it so you can get things done with 2 to 3 clicks maximum. Because that was the one thing my dad promised us early on. He said, I don't care how you do this. I just don't want to die a death by 1,000 clicks. And so,
Yeah. A
yeah,
thousand clicks.
we've got an easy to use system. And I think our team behind us is a huge difference maker as well, because, you get heard. You can call us anytime. There's real people. And all of us have worked on this from the beginning. And so I think that should give people confidence that even if it's not exactly what you need, we'll make it there and you'll have the white glove treatment the whole time.
Awesome. Where do you want EirSystems to be in the next 6 to 12 months?
Yeah, so we've got some exciting, EHR partnerships going live in the end of this year, and then we've got some pretty big government contracts as well. And so 6 to 12 months, I'd love to break that, million, $2 million mark, which we're on track to do this year, which is great. And then eventually we want to replace and become the dominant EMAR on the market. So we want to become the epic EHR of EMARs if we can. And so that's going to take a lot of growth to get there. We've got to have the right team behind us and the right people, kind of propping us up. But we've got a great opportunity, and we're super excited about what this is going to look like in 24 months from now.
That's awesome. And what's unique focus on the 4 Ps of healthcare? What is that? What are the 4 Ps?
Yeah, so it's patients. So basically, it's about focusing on everything that having to do with healthcare: the patients, the providers, the prescriptions, and then the places. So they're the actual locations. And so I think that's what people tend to try and focus on, one sector of that. But you got to make sure the clients are treated right. Got to make sure the clinicians feel safe. And also every location we find, every single facility has different workflows. So try to make it so that they can feel that this is built just for them. It fits their workflow. And then you're going to get a lot less support tickets, which is always awesome.
Yeah, that's good. Awesome, bro. Well, Ryan, thank you so much for joining us on the Advisors on Growth podcast. It's been a pleasure. For those of you who want to check out Ryan Seaberg, he is located on LinkedIn if you want to look him up in his profile. Also, don't forget to go to EIRSystems.net. That's EIRSystems.net, and check out his website. There may be some use case for you. Thank you, Ryan.
Yeah, thank you so much, Derek. This has been amazing, and I hope all of y'all have a great day.
Awesome. You too, sir. It's been a pleasure.
So
Until next time.
yes, sir.
Don't forget to subscribe, like this video, and leave us a comment. Thank you.